Good afternoon, everyone. Thank you so much for attending this afternoon's session. I'm honored to present to you our speaker today is Dr. Sharum Sharif, who graduated from Bastyr University. He has primary care practice in Kenton, Bellevue, Washington, and is an affiliate clinical faculty at Bastyr University now. And he's written a book titled Visual Homeopathy, Identifying the Common Constitutions Within Minutes. And he's developed an extensive website, www.visualhomeopathy.com, with numerous patient videos for the purposes of teaching constitutional homeopathy. He's taught homeopathy at naturopathic schools in the US and Canada, and has presented at various statewide, regional, and national naturopathic associations. Thank you so much again for coming. We look forward to seeing you all at the gala. Enjoy the rest of the presentation, and thank you so much for being here.
Thank you so much. Thank you. Thank you. In my practice, I have a primary general care, naturopathic practice, but I focus on skin and GI disorders. I have presented at AANP a couple of times so far. This is my third time. It's an honor to be here for the third time presenting. Why did I choose to present on the subject of skin? Frankly, it's because every 1 out of 4, every 1 out of 3 patients that I see in my practice have a skin disorder of some kind. And I'm sure you run into that too if you have a primary care. So I found that before I did homeopathy, my success in treating skin conditions was minimal. So out of necessity, I started to prescribe homeopathic remedies for treating skin disorders, and my success rate just escalated. So really over the last 10 years, I would say, I've gathered probably 500 patient videos and pictures before and after homeopathic treatment. And it got to a point where I just felt compelled to want to share that with you guys. So may the information be helpful in your practices. So as you know, most of our skin patients, they're prescribed to take either topical steroids or oral steroids for treating their skin disorders, right? So I love this quote from Dr. Savely Yorkowski, medical doctor. He says, even though classical homeopathy for nearly 250 years and traditional Chinese medicine for 5,000 years have been rendering consistent observations, tying skin conditions to the health of internal organs, the conventional dermatologists, with all due respect, they still remain in a dangerous trigger-happy cortisol mode concerning the majority of skin problems. So what is the problem with steroids? You probably know all about the problem, but aside from all the side effects, steroids are clearly not helping heal the skin, as you know. Just at the very best, they just palliate symptoms. They get rid of symptoms, but as soon as you stop the use, the symptoms come back usually. So skin. So that's where internal diseases manifest, right? In my experience, when something appears on the skin, in my opinion, that's usually a sign of a toxic state inside the person. I would say all traditional systems of medicine have this view in common. They all believe that by the time something shows up on the skin, there's something wrong with our insides. So the aim in homeopathy is to address that imbalance on the inside, as opposed to palliate the surface on the surface. So skin signs and symptoms can be an early sign of many potentially serious skin conditions such as cancers, and they can sometimes be an end result of another condition. So it can be an early sign or a late sign of another underlying condition. Skin signs and symptoms can help us solve a patient's puzzle. So for those of you who do constitutional homeopathy, if you're having a difficult time finding a person's constitution, you may be able to arrive at the constitutional remedy if you look at the skin more carefully. And we'll talk more about that. So it's a way to solve that puzzle, like what is the person's constitutional remedy. And once you find the remedy, not only are you able to help the person's skin signs and symptoms, you're able to treat all kinds of other things that are out of balance with the person. And that's as you know, that's what homeopathy is about. So we're going to discuss many subjects today. One is homeopathic philosophy in regard to the treatment of skin diseases. The next one is suppression and healing, the healing reaction in homeopathy. We're going to cover the basics of diet, food allergy testing, and my two main favorite supplements for skin disorders. We're going to talk about the significance of proper diagnosis and assessment, the basics of homeopathic case taking, which is critical, acute versus constitutional prescribing in homeopathy, in particular for skin disorders, how to prescribe. Do you look at the skin signs and symptoms, the signs on the skin, or do you look at the person's constitution or miasmatic background? Dosing, which includes potency and frequency, and what to expect from homeopathic remedies in treating skin disorders, and then homeopathic repertories, and as relate to skin. I'm going to cover the top, quote-unquote, skin-specific remedies including antimonium crudum, graphites, mesothelium, sulfur, soranum, and petroleum. Then, of course, last but not least, we're going to cover all the different common skin conditions, the top 25 to 30 most common skin diseases and their homeopathic differential diagnosis. Okay, so homeopathic philosophy for treating skin conditions in a nutshell is suppression is not okay. So that's the opposite what conventional dermatologists tend to do, which is suppress signs and symptoms of skin disorders. So as a rule, I would say homeopaths and dermatologists couldn't have a more opposing views on health and healing, as I'm sure you would agree. So symptoms in general, but in particular in the skin, are an expression that the body is trying to heal itself, and as such should not be suppressed. Suppression can push the illness deeper into the body, and I know I'm preaching to the choir, but some of you guys might be new, and I just don't know who's going to be watching this later, so we're going to cover some basics. Homeopathic remedies stimulate the body to heal itself on an energetic level, as you know. So what's wrong with suppression? What's wrong is that the disease goes deeper, as we just mentioned earlier, but these are some examples of what can happen. So if someone has eczema and you suppress it, you can get asthma, and I'm sure you've heard about the asthma-eczema triad. And so what about heart diseases? What about all these other internal diseases you could get from suppression? According to Dr. Burnett, you could get angina. He had apparently run into that at least once, if not more. According to Dr. Robin Murphy, my favorite homeopathic teacher here in North America, you could get all kinds of problems by suppressing skin diseases such as sciatica, facial neuralgias, headaches, and even insanity, especially if you put corticosteroid cream on the scalp. According to some of our literature, you can literally develop insanity. So how do we treat skin disorders in homeopathy? Clearly, we're giving an oral medication or remedy to clear the imbalance on the inside. So we really don't, as a rule, believe in topical anything as homeopaths, but of course as naturopaths, you can use non-suppressive topicals. Okay, so diagnosis, it's critical. It's critical that we figure out what's wrong with the person with their health. So first, you need to rule out internal systemic diseases. I find that I'd say as a rule, most skin diseases I can diagnose it by visual detection. Sometimes we need a detailed history and physical exam. Sometimes we need to refer to a dermatologist for a biopsy. But as I'm sure some of you guys with more experience have run into, most of our patients have already been to dermatologists, if not multiple dermatologists, at least one or two. Most of my patients have been to 3, 4, 5, 6, 7 dermatologists. And by the time they find their way at my office, they've been properly diagnosed, they're just not getting treated. The treatment is not working. So the diagnosis is not typically the problem, it's the treatment. That's where the challenge is. How do you treat these diseases? And of course, don't forget to rule out mental emotional etiology, like OCD can cause excoriation disorder. And so you need to make sure if somebody is demonstrating excoriation, that it's not of a mental origin. Okay, so why is diagnosis important again? So I'm going to show you a video of this patient named John. He came in with systemic itching, pruritus for many years, and nothing was helping it. Corticosteroid cream, oral medications were just suppressing to some extent, but even pharmaceutical medications were just partially helpful. So long story short, his constitutional remedy, which was sulfur, ended up helping him to some extent, maybe 30, 40, 50, 60%. And within a few months, I decided that this isn't even helping. So I had to go back, look at his history, and I asked him some questions about his past. It turns out he basically didn't drink water ever. He just drank Kool-Aid and coffee. And he was a blue-collar worker, so all day long he'd be in the sun, sweating, and he just didn't hydrate for years. And sulfur is usually a very healthy people, but I think his kidneys, his blood lab test showed that his kidneys were abnormal. And he hadn't discussed that with me. So I just put him on a naturopathic cleanse, liver and kidney cleanse, and day by day he rapidly recovered and his itching just completely went away. And then his constitutional remedy sulfur was able to did the last touch up. So even homeopathy sometimes doesn't quite cut it for skin diseases. Sometimes you have to do detox, and we'll talk more about that. So diagnosis, it may be difficult when the person has history of suppression. So you put corticosteroid cream on, and the signs and symptoms go away, and you look, and you're just not going to be able to figure out what the skin looked like prior to the treatment. So you have to ask the person, what did the skin lesion, what did it look like prior to treatment, right? So you can't just say, oh, this is what it looks like now. It could be looking a lot better because of the steroid, right? So you need to always ask, what did it look like prior to steroids? Okay, diet. Of course, each one of these slides, we can go in depth into each one, like in regards to diet. You guys probably know more about diet than I do. There's so much about diet and skin. In a nutshell, I find food allergy testing extremely helpful. But for those of you who are really into diet, you might be disappointed to hear how I feel about that. I feel like diet even can be used palliatively. So when it comes to skin, you can avoid gluten and dairy all you want, but as soon as you eat them, the symptoms, skin signs and symptoms might return. So I feel like even diet can be used palliatively, more often than not. So, but homeopathy, if you do it right, you could get a person to be healthy enough so they don't have to avoid every food under the sun. So you can actually make a person feel strong enough so they can tolerate all their food allergies and sensitivities. So I believe homeopathy could potentially more curative than even diet, and I realize that's a big statement to make. So my top two supplements are for treating skin problems or for helping with skin diseases would be probiotics and essential fatty acids. I'm a big fan of probiotics for psoriasis, eczema, and hives. Okay, skin testing. So a lot of my patients with skin diseases have been to dermatologists and allergists, and they've done this skin prick test on the back, where you get pricked at least 100 or 200 times. I find that this skin prick test is, for all practical purposes, not at all helpful for helping patients with skin diseases. I find that a blood test, the IgG, IgE, blood test that most of you guys are familiar with, is far more helpful than a skin allergy prick test that conventional allergists perform in their offices. And in particular, the IgG testing is great for chronic disorders such as eczema, and IgE is helpful more for acute skin diseases such as impetigo. Of course, it can both be helpful for both, but if you were to generalize, that's been my understanding, that's my finding. Okay, homeopathic case taking. Now, this is where it gets kind of interesting because case taking in homeopathy differs from one branch to another. So like psychiatric case taking is very different than skin case taking. So for skin, you want to look at all these things that I've outlined in these two slides. First and foremost, the appearance. Obviously, you want to pay attention to the appearance of the skin. So color, discharge, and consistency are critical. Discharge in particular is extremely important and helpful. So let's say if the lesion has a honey-colored yellow discharge, you should be thinking of graphitis potentially. If you have yellow discharge, potentially think of hydrasis. Yellow, especially thick discharge from the vaginal area. Sensation is the next thing you want to talk about with your patient. What does it feel like? You want to get very detailed. Does it feel numb, tingling, itching, biting, pricking, etc.? Is the pain a sticking kind of pain? Or is it a dull kind of pain? Does it feel bruised? So those are all the sensations. And then the sensations are then qualified by the modality. So what makes that sensation better or worse is important. So if it's, let's say, if it's itching, what makes itching worse, what makes it better? So the modalities are very, very important in homeopathic case taking of skin conditions. So location or sphere of action is also important. So what part of the body is the skin being affected? Hands, scalp, etc. So, and then concomitant symptoms. And what that means are symptoms that are in the picture, but they may not be related to the skin at all. So let's say if the person's anxiety is triggering the itching, then anxiety is a concomitant symptom. So if the anxiety is severe enough and then you get severe itching, you ought to be thinking of anxiety remedies like arsenicum, especially if it's got all the keynotes of arsenicum, like burning, itching, which is better with heat, which is the SRP for arsenicum. So you want to be thinking concomitant symptoms. That can really give the case away. Okay, so more on discharges. With discharges, they can just clue in on the remedy like that. So if you have bloody discharge, you go down a certain path. If you've got clear honey-like discharge, you go down a different path. So the color and the texture of the discharge is really important. Those are some rubrics from the repertories, different repertories I've listed for you guys. So like if this is honey-like, then you think of graphites. If it's bloody, you may want to think of some various other remedies, including the top two snake remedies. And if it's bleeding after scratching, the last rubric, bleeding after scratching when the skin is dry, you want to think of aluminum and some other dry remedies, aluminum being towards the top of the list, or petroleum. Okay, so remedy selection. This is a big, big subject, but of course, if you're experienced as a homeopath, you can just, obviously the first method you can utilize to come up with the remedy would be just go off the top of your head if you know the remedies well enough. If you don't, you want to use therapeutic books where you can get like a differential diagnosis. And you can come up with the top few 2-3 remedies, and then you can study them and make sure they match your case and send the patient home with the top 2-3 remedies. I'll talk to you more about that in a minute. And the best way would be, of course, to repertorize, which takes a long time. And if you have a primary care practice like I do, I just really honestly, most of the time I don't have time to repertorize, but sometimes I have to. So, and I'm experienced enough, usually I just don't use the repertory unless I feel like I really don't know the remedy. I have 10 remedies to pick from, then I'm like, I have to go to the repertory. But if I know 2 remedies that very nicely match the case, I just give the top one, my first choice, and the second choice to the patient to take home with them. So I do a lot of, here's 2 remedies, try this one, give it 24 hours. If you don't see any symptoms, try the next one. I do a lot of that, and a lot of experienced homeopaths do, so that's not a crime in case you happen to do that. You don't have to know the remedy, which is what most of us homeopaths or people, homeopathic practitioners, try to do. We feel guilty if we don't know the remedy. There's a lot of guilt in homeopathy. There's so much guilt. Like Dr. Murphy said, Hahnemann is not going to jump out of his grave and cuss you out, you know, if you get the wrong remedy. So you want to always ask, what should I focus on first? So if the patient is coming in with itching, but their chief complaint to you appears to be fear and anxiety. I mean, you're seeing fear, they're saying my arm itches. And you're seeing fear, that's all you see, and anxiety. You've got to be thinking of anxiety remedies like arsenicum. The person is coming in and they have a particular skin complaint, but you smell this strong foul odor in the office. It's just hard to put up with. Then you've got to be thinking of smelly remedies like creosotum or thuya, sulfur. And if the sensation is extremely disturbing, like just the most painful itch, you want to think of mesothelium. So think of what you should focus on first. What is the worst thing about the case? You want to think about that. And the patient may not be telling you that. The patient may just come in talking about an itch, but the worst thing about the case could be fear. So if it's fear, you ought to be thinking fear remedies that have itching. So, and etiology is sometimes extremely important. So let's say if I were to fall off this thing and end up with a bruise, it doesn't matter what the bruise looks like. It was caused by a trauma. So you want to think of trauma remedies like arnica. So sometimes etiology prevails pathology, in my opinion, and I think a lot of homeopaths would agree. Etiology is extremely important. So acute versus constitutional prescribing. This is probably the most critical question to address today. Most homeopaths, the ones that are classical, they do constitutional. So if you do acute, they're going to think low of you. And then there's a lot of naturopathic doctors that do acute prescribing, and then over on this side, constitutional classical homeopath like me will think low of you. They're like, oh, there's a naturopath doing acute prescribing. They don't know what they're doing. But really, there's place for both. And if you know how to combine both, that's when you get the best results. So as you know, a constitutional remedy in homeopathy focuses on the person's or engulfs the person's mental, emotional versus physical signs and symptoms, the whole picture. I just tell my students a constitutional remedy covers the whole patient minus their spirit. So it basically covers everything about them. Temperament, behavior, mental, emotional patterns, physical body. And the acute remedy addresses a few of the patient's symptoms. So to treat the skin conditions, you might need to use an acute remedy, and we need to talk about that. So when it comes to remedy selection, you want to look at the center of gravity. So if the person is healthy in general, but they have a severe severe acne or severe whatever, then the acne or that particular condition is the center of gravity. But if the patient's overall health is down and they have a skin condition, but the overall health is down, then the center of gravity is the overall picture, the whole person, not that particular skin condition. Does that make sense? So you want to know the center of gravity, and that's how you're going to know whether you should do acute or constitutional. Few more notes on the subject. If the constitutional remedies, keynotes, cover the key features of the skin disorder, then the constitutional remedy can be curative. So let's say you get a particular kind of eczema. It's not too severe. You don't get deep bloody cracks. You just have a mild case of eczema. The person's constitution is healthy, and they have this dryness running through them. You're thinking potentially Nadmir. You're asking mental emotional questions. Nadmir. You give Nadmir. So Nadmir covers the eczema. But if the eczema you get deep cracks that are bleeding, very, very deep and bleeding, that's not a Nadmir kind of eczema. That's when you think of acute prescribing like petroleum. We'll talk about that. So if the acute remedy helps, but the skin problem keeps returning, then what do? Then you want to be thinking constitutional, right? Or miasmatic. Kind of common sense, really. So the next one, when do you do acute? The opposite, it's basically the opposite of what we just talked about. If the constitutional remedies keynotes do not cover the key features of the remedy, then you think of acute. If the skin signs and symptoms clearly point to a particular remedy, then you think acute. So let's say if I, again, were to fall off of this thing and I bruise myself, that you're thinking that the bruising is arnica, right? You don't even have to necessarily think of my constitutional remedy. So if you have a case of eczema with severe deep cracks the cracks are bleeding, you want to think of petroleum, and you don't have to worry about the person's constitution. And if you give the constitutional remedy, the problem doesn't go away, then you obviously, again, need to think of acute. So those are the different scenarios where you want to think about acute prescribing. By the way, this is, as you can see, it's a long, very thorough presentation. It's supposed to be like a resource for you guys. We're not going to cover every single slide, but this is more of a book. So it's supposed to just be more like a reference guide for you guys. Okay, so let me go to my website here. I want to show you some cases where acute was absolutely critical. Okay, so this is my homeopathicdermatology.com website. So this video, the picture is of a boy. As you can see on the left, you see the deep cracks that are bleeding. So that's a petroleum case. As soon as I saw this young boy, I thought to myself, he's a NADVIR kind of a constitution, but the eczema is so severe, he couldn't even stretch his arms out. His arms were like that, because if he went like that, the cracks would open up and he would bleed. So it was a severe case of eczema, and I just thought petroleum. I gave him petroleum 12C daily, and within a week, as you can see, within a week the eczema was basically almost entirely healed. And then later on, when he no longer had such a severe case of eczema, then I just kept him on his constitutional NADVIR maybe once a month, so this wouldn't come back, right? So that's one case where you need acute. So this is another case of an acute case. Rick here on the left side, you can see him with severe erysipelas on the left cheek, and he's got the purplish, bluish mottled skin, and it's on the left cheek. And honestly, as soon as I saw that and heard what he had to say, I'm thinking infection. It looked like erysipelas to me, and I thought, I wonder if lachesis would take care of that. And I knew he was a constitutional NADMIR too, but NADMIR doesn't have those keynotes. Bluish, purplish, mottled skin, it happened to be on the left side. What a coincidence. So I gave him lachesis 200C, and overnight he was 90% better. So that picture, the after picture is overnight. No antibiotics. This woman is a constitutional phosphorus, and she developed this very red, burning, stinging, kind of edematous situation in her lips for a few weeks. She saw me. She had already tried phosphorus, which is her constitution, and phosphorus had not helped her at all. And you can, by the way, you can click on those videos and watch them at your own time, on your own time. I just didn't want to take the time right now. But I wrote little paragraphs under each one for your education. So phosphorus wasn't helping. So I thought to myself, okay, this is swelling. And I said, does it feel tight? She's like, yeah, my lips feel tight, like they're going to just burst. So at that level of tightness, anywhere in the body where you're retaining that much water and you have stinging pain and it's hot, and she said she can't apply hot, like she can't even take a hot shower, is what? Apis. So I gave her Apis 30C. Good job. Apis 30C daily. It was helpful. It went away, and 2 weeks later it came back. So I said, no, maybe she needs a stronger dose. So I gave her Apis 200C. In 4 hours, it was cured. 4 hours. She called us. She said, gone. All of the symptoms were gone. So that's acute. Okay, this is John. The patient was Kool-Aid and coffee, remember? And it wasn't until I detoxified his kidneys that the itching went away. His constitution is sulfur, but sulfur didn't touch it. It helped. I shouldn't say does. It helped. It helped 30, 40, 50% maybe, but he really had to do a detox. And I was like, you are obviously sulfur. How come it's not working? We tried different potencies. It just wasn't working. So kidney detox, drainage really is what really did it. So for those of you who don't believe in acute prescribing, those are examples of when you do need acute prescribing. And then for those of you who are only doing acute and don't believe in constitutional, those patients overall feel really well when they're on their constitutional remedy. When they take phosphorus, that woman has no anxiety. Once a month she takes phosphorus 1M or 200C, feels awesome. But then when this thing happened, she needed Apis. So there is a place for constitutional and acute, because we don't have to choose one. Acute prescribing can aggravate if you're not careful. So what do you do to not cause any aggravations? Well, we can control the aggravations by adjusting the dose and frequency. So like say 12C daily instead of 200C once a week. You can do 12C daily or 6C once a week. You can prevent aggravations and still do acute prescribing. You don't have to be scared. I love this textbook. There's this textbook I got from India. It's called Textbook of Dermatology for Homeopaths. I find Indian homeopaths, they write the most amazing books. Some of which we just don't have books like that here, like Textbook on Dermatology, Homeopathic Dermatology. I found 4 or 5 of them written by Indian homeopaths, and this one in particular is my favorite. The authors of this book are both dermatologists. They teach at medical schools. They teach dermatology in India, and yet they're homeopaths. So their work is just amazing. I learned a lot just studying these books. So now notice how they categorize it. They're saying that you can find remedies based on appearance, based on constitution, or miasm. And they're going through it one by one. And honestly, I wish I had this book years ago, because as soon as you look at that one slide, that's invaluable. It's priceless. See, it says that if you have there's like 7 different types of appearances. So based on those appearances, those are the remedies these 2 dermatologists are recommending. So let's say if you have number 2, if you have a thick, dry lesions, you want to think of those remedies, and in particular, graphites and antimonium crudum are my favorite. If you have ring-shaped lesions, as is the case in, say, tinea, let's say you have tinea on your chest, tinea corporis, and you got the ring-shaped lesions, well, you want to think of those remedies, and look, the first remedy is basilinum. It just so happened, after 2 years of looking for that remedy, I figured out basilinum is a really good remedy for tinea, and here it is. It's the first remedy they list in their book. So this slide is just precious. It is, I just love it, because I wish if I knew that, I would have been really helpful for the last 15 years. I've come up with that knowledge on my own, but it's just taking me so long. But so if you have the right resource, which now you do, because you have 140 slides, you can go to these slides and just look things up, as opposed to having to reinvent the wheel. Hyperpigmented and hypopigmented lesions are listed there with the appropriate remedies. Cracks, notice the last one, cracks. Petroleum is there. Remember the boy that couldn't stretch his arms, right? That's cracks, deep cracks, petroleum. Okay, so you can prescribe based on constitutions, and these are these 2 dermatologists, homeopathic dermatologists, constitutional remedies, favorite constitutional remedies for treating skin disorders. And then when it comes to miasmatic prescribing, they're recommending no-sodes, which is something that is really beyond the scope of this talk, but I can just tell you no-sodes can be extremely critical in treating skin disorders, like tuberculinum, metaurinum, syphilinum, psoriasis. So it gets a little bit hairy. So I'm not going to get into that too much right now. So dosing. How do you dose? Well, this has taken me, I'd say the last 2 years, I've been trying to figure out what's the safest way to dose skin patients. And that's what I've learned right there. For acute, you can do 30C 2 to 3 times a day initially. And as things get better, as needed is a really good rule. So let's say within 2-3 days into it, let's say you take a remedy, whatever, petroleum, right? 30C twice a day for the first 2 days. As soon as it gets better, you can spread it out like every 2-3 days. And as soon as that, the patient is like, I'm still feeling okay. It's been 3 days. I'm like, well, don't wait 4 or 5 days. So take it as needed. So that's for acute. Very simple. 30C initially, daily, but then every few days, etc. What about for non-acute, chronic conditions? Then I'm thinking of lower potencies like 12C, 6C. Now, when I was less experienced, I used to always do 200C and 1M all the time. And that's maybe fine in certain situations. But for skin, if you give it 1M and it's the wrong remedy and the person has psoriasis, that's not a good thing. Because if psoriasis is already difficult to treat, it's probably the most difficult to treat condition I've ever had in my office. Of all the conditions, I say psoriasis is towards the top. So if you give the wrong remedy and make it worse, then that's not a good situation at all. I've heard of disasters when you give a 10M, 50M to a psoriasis patient. I mean, you could really mess a person up. So I would say 12C, 6C is much safer for chronic conditions, and it works beautifully. You don't have to do everything in a day or a week. Okay, so higher potencies. When do you use higher potencies? You can use it if the patient is stable and you're confident of your prescription. So there are 2 big ifs. If the patient is stable and you're confident of your prescription. If you're not so sure, and the person or if the person is not totally healthy, they have like 10 different chronic conditions, I just wouldn't even prescribe 200C. Or if you do 12 1030C, you're doing well, and at some point you find you find that you need to go higher, you can do that. But you got to be cautious with 200Cs and higher, in my experience, in particular in regards to skin diseases, because you really can't afford to make them worse. What to expect from remedies? So this is a tough subject to talk about. This is the best I could do for you guys. You want to follow Herring's law. So if the eczema is all over the body and you're treating the person, the top is going to get better first, and then the bottom. Inside and out, top to bottom, mental, emotional gets better, and then physical. Remember Herring's law? So that's what you can expect that. So Dr. Herring's was right. I've come to see he was right. So if eczema on the arm, you have eczema on the arms and legs, the arm is going to get better first, and then the legs. Toes are the last area to get better. So, and then as far as sensations or symptoms versus signs, what's going to get better first? I would say symptoms improve and then signs. So sensations improve first, then color, then secretions, then physical lesions. And if you think about it, it makes sense. So the phosphorus woman with the apis lips, the first thing she said during the first minute or two is that she doesn't feel as hot. The sensation of heat went away. And then she said the tightness went away. And then 20 minutes later, the redness was reduced, and the cracks in the corners of her mouth probably went away the next day. See, because the cracks are physical lesions, the physical things don't improve that fast. The sensations improve faster, right? So it's a good way to summarize it. So if someone comes in, they have oozing graphitis coming to a lesion, and they're asking what should I expect first, well, the symptoms improve first, and then the signs. So you may want to remember that. And what if you don't know the exact remedy? And most of the time you're not going to know the exact remedy in regards to the skin in particular. One is that there are numerous remedies for every skin condition. The second reason you're not going to know the exact remedy is that we have like 3-4 keynotes for a skin condition per remedy. You don't have a lot of keynotes for skin conditions. So, and you have like 100 remedies listed for psoriasis. So how are you supposed to come up with the right one? So we have a few indications for each remedy, and there are numerous remedies for every condition. And then thirdly, most patients don't tell you what exactly you need to hear. You have to get all the symptoms from them. So it's almost impossible to get the right remedy first visit unless you're highly experienced. So oftentimes I send the patient home with the top 2 remedies or top 3 remedies. And if I know it, like the apis person, I knew it and I knew it was right, it did work. But if you're not sure, there's nothing wrong with doing what I'm suggesting, top 2 or 3 remedies. And there's a high likelihood that you're going to cover the case, you're going to help the patient because you picked the top 2 or 3 remedies, right? You've done your homework, you've come up with 3 solid remedies. So of course one of them is going to help. Aggravation. All I got to say about aggravation is that you just don't want to cause it. Don't cause any aggravations, because once you cause aggravations, it's hard to go back. So that's why I focus on lower potencies, and I don't recommend frequent dosing. And if you get aggravations, it doesn't mean that you messed up. It maybe means that you gave it at too high of a dose too frequently. It doesn't mean the remedy was wrong. You could have the correct remedy, just maybe you dose it too high or too frequently. And if you have aggravations, obviously stop, go to your closest Starbucks and drink a cup of coffee, and that could actually help. But I wish it was that easy. I wish you could just kill the remedy like that. It's difficult to antidote the remedy, especially if you've given it too much. Like a 200C every other day, which some naturopaths do, very careless. 200C for a skin condition daily for a week, or twice a day for a few weeks. I've seen naturopaths do that. I'm like, man, you don't want to give 200Cs unless you have some good training. Unless you have read my slide like 3 times front to back, I would do 200Cs. So stopping and starting drugs and starting homeopathic remedies at the same time. This can get really tricky. If you're giving a remedy to someone, prescribing a remedy, and at the same time they start corticosteroid cream and they get better, no one is going to know what did what, right? Or if they stop the cream, then you still, if they get worse, then you don't know, are they getting worse because of the remedy or they're not doing the steroid? So watch out for that. Repertory in the skin. There's a whole chapter in the repertory on the skin, as you know. But did you know that the general section, the generality section has a lot of information on the skin, and the various body parts allude to skin. So you can look under face. Like acne is, the whole thing about acne is that acne is not even in the skin section at all. Acne is in the face section. So you have to really know your way around the repertory, and I've summarized everything you want to know right here. So you can go back, we'll see. One of my favorite rubrics is skin unhealthy. skin, you go to the skin chapter and you look under the unhealthy skin rubric. A lot of the good skin remedies are listed in that rubric. It's a really good rubric to know. So some rubrics have like 200 remedies listed. So what do you do in a situation like that? Well, find a rubric, find the closest rubric or rubrics that cover the case that have 40, 50, 60 remedies in them. To me, a good size rubric for skin, treating skin conditions is when you have 40, 50, or 60. Maybe, I don't know, 30 is okay too. But if you have 10, I'm not really 10 or less, I'm like, it may not be helpful. Your remedy may not be in that rubric. So there are a lot of small sub-rubrics for skin, and the smaller ones, they don't, I mean, it may be helpful. The remedy may be in that sub-rubric, but just, it's good to be more open. Like, okay, but let's see, can I go up above that sub-rubric and find a rubric that has a higher number of remedies? That would be helpful. So what if the condition is not in the repertory? So this is really tricky. Like, I had a patient with this condition called pruritus nodularis. Have you ever heard of that? Pruritus nodularis? Who has heard of that? Okay, good. Because I've only seen 2 patients in 15 years with that condition. So that's not in the repertory. At least I couldn't find it. So the way you find the rubrics to cover a case like that is obviously you have to find all the keynotes of the case and go find those keynotes in the repertory. So you want to base your rubrics based on the patient's skin, the appearance of the lesion, the discharges involved, sensation, modalities, and location. So you take a good case, then you go to the repertory and find the answer to all that in the repertory. Follow? Right. Okay, so in the repertory, as you know, each remedy is either in type 1, type 2, or type 3. Type 3s are the ones that are in bold, type 2 is italics, type 1 is just regular font. I really would pay attention to the ones that are in bold, and maybe not all homeopathy would agree. Homeopaths usually like to make things really complicated. So I'm a naturopath first and then a homeopath. So I like to simplify this for the rest of us. So the ones that are in bold, they're really important. So you want to pay attention to the ones in bold. And if you just look at those and ignore the type 1s, let's say, and just look at type 2s and type 3s, no one is going to come and sue you. So a lot of naturopaths are scared of doing that. They think they're doing it wrong because we're taught to pay attention to every remedy in every rubric. If you do it like that, it's really difficult to get started in homeopathy. So just look at the ones that are in bold type 3, and you could help a lot of patients. Okay, but having said that, even type 1s, a type 1 could happen to be the right remedy. So just because a remedy is not bold italics doesn't mean that's the wrong remedy, obviously. So there are a lot of type 1s in the repertory, but I've just basically listed type 3s and type 2s in my talk. Okay, so these 2 slides have to do with certain words in the repertory that are difficult, that were difficult for me. I didn't know what cicatrices meant, or what is it? Ecthyma, excrescences. Like, who knows what excrescences means? Yeah, okay, not many, right? So that's warts. That means warts. Ichthyosis. Do you know what interpterygo is? Who knows what interpterygo means? Interpterygo? Not many. So these are the toughest words I could find in the skin chapter. I went through the whole thing like 10 times, front and back. And I wrote them down so in case you're using the skin chapter and you're wondering what does phagedenic mean, because I saw that and I thought, what am I doing giving this talk? I don't even know what some of these words mean. This is when I was preparing for this talk. It turns out some of these words are so old that most of us more modern physicians, we don't know what some of these words mean from 200 years ago. So you have to look them up. So I did all the looking up for you. So phagedenic is a type of ulcer. So those are the toughest words I could find. There are some other words that are maybe you may not know, but those are the main ones. Okay. What about, is there such a thing as skin-specific remedies? And what are the top keynotes for these different skin remedies? In my experience, and again, for constitutional prescribers out there, you're going to hate me because you just want to think every remedy can be good for skin. And there is no such a thing as a skin remedy. See, constitutional prescribers, they don't believe in skin remedies or remedies for depression, because any remedy can be good for depression. That's true. But there are skin-specific remedies. There are remedies that actually have an affinity for the skin. So I focus on those remedies here, and I'm going to cover them very quickly. The top 14 remedies right here. 2 different slides. The first one lists, it's all in alphabetical order, alumina, antimonium crudum, apis, arsenicum album, calendula, graphites, lachesis, lycopodium, mercurius, mesothelium, petroleum, psorianum, rustox, sulfur, right there. Those are the top 14. Of course, there are many other acute skin remedies like belladonna, arnica, iris that I just didn't have room to type them all in. But these are the top ones I use quite often. I use these basically every day in my skin practice. Lots of antimonium crudums. I do a lot of arsenicum, graphites, lycopodium, petroleum, psorianum. These are very commonly used if you're treating skin conditions. So the highlights, the keynotes of each remedy, the ones that really matter, I've listed them. So as you can see, like for aluminum, I wrote down the most dry and constipated remedy. For antimonium crudum, they have very, very hard skin. So hard, thick skin. Apis, we talked about that. Arsenicum, you have burning pain that's worse, that's better with heat. So they have burning pain that's better with heat. That's kind of interesting. You would think if they're burning pain, they're better with cold, right? Like some other remedies, but like Apis. Apis is hot, but it's better with cold. Arsenicum, they have burning pain, but it's better with heat. So they burn themselves and then they go run it under hot water. It feels better. That's an arsenicum situation. But if they burn themselves and they go take a cold shower, that feels better. That's Apis, right? All burning pain. In fact, another remedy that I had here had that. I forget which one that was. We'll run into that. Can't think of it. So all these modalities, again, matter. So if it's burning but better with heat is one remedy, worse with heat is another. Modalities in skin really do matter. Better with, worse with. Okay, conditions. Now this is why you guys came here, to learn about the conditions. And we're just starting the conditions. So far it's all been legwork. We've done all the introduction. Now from this point forward, we're going to cover all the different 25, 30 conditions. And we're going to fly through them because you have this, right? You're going to get it on CDs, right? Is everybody going to get CDs here, by the way? Online. So you will have access to this, right? Okay, good. Because there's no way we're going to cover this. You're going to have to, this is like, remember, it's a reference. I'm not going to cover all the skin conditions, obviously. I'm just covering the top 25 or 30. I'm not covering skin cancers, STDs, etc. Autoimmune diseases that involve the skin, like lupus and scleroderma. We just don't have to cover them all. So the ones that I'm covering are basically categorized, like you can see on the right, infections of skin, bacterial, viral, fungal infections of skin. I'm covering disorders of the sebaceous glands, such as acne. We're covering allergic skin disorders, such as atopic dermatitis, otherwise known as eczema. We're covering diseases of pigmentation, such as vitiligo, and miscellaneous other skin diseases such as bruising, burns, cellulitis, gangrene, hives, pruritus, psoriasis, scars, ulcers, and wounds. Okay, so the sources that I've used to prepare this presentation are the Synthesis, that's my favorite book, Homeopathic Clinical Repertory by Dr. Robin Murphy. I find that Dr. Murphy's repertory is much more suitable for modern homeopaths because it's in alphabetical order, and like he has the condition where you would expect it to be. Let's say psoriasis, you go to his skin chapter, you go to psoriasis, so skin, psoriasis. Whereas in the repertory, in Synthesis, to find psoriasis, you have to go to the skin chapter under eruptions, and then that's where you find psoriasis. So it's skin, eruption, psoriasis. With Dr. Murphy's repertory, it's more common sense, like skin, psoriasis, right? You don't have to be a genius. You don't have to have had training for 10 years to be able to find the remedy. So in Synthesis, just finding the rubric takes a long time sometimes. No, seriously. Let's say like tinea. To find tinea in the repertory in Synthesis, who knows where tinea would be? Like what rubric would you go to find tinea? Maybe that would be one of the rubrics. But there's actually a rubric in the repertory for tinea. It's under skin herpetic cincinnate or cincinnate or something like that, which means circular. You'll see that it's all listed there in my presentation. So it's skin herpetic cincinnate, which is, most of us I don't think would know that. So whereas in Dr. Murphy's repertory, it's just right under tinea. It's much more common sense. So I use the textbook of dermatology for homeopaths by those two wonderful dermatologists from India. I've used Dr. Roger Morrison's blue and red books. You guys all have those two books? I love them. And Dr. Robin Murphy's lectures on skin disorders. So acne, this is the first condition. It's one of the most common conditions we get to treat in our practices. well, most people just say acne, but it's acne vulgaris is the full name. Of course, you know, most of my patients that come in with acne, they either are or have been on antibiotics for what, 10 years, 5 years, many years of antibiotics. Spironolactone, God knows for how long, and birth control pills, right? You see them, right? You see these patients with acne. So can you imagine taking antibiotics for 5 years, 10 years, see what it does to your immune system, and the person ends up with an autoimmune condition, and they're wondering why did they get an autoimmune disease? I'm like, well, you use antibiotics for 10 years, maybe that has something to do with it, ruin your gut. Or birth control pills, which, by the way, I'm like so anti-birth control pill, and I'm kind of discouraged. A lot of naturopath friends of mine, they prescribe birth control pills, just flabbergasted. It's so difficult for the liver to process birth control pills. So I've seen hundreds of patients, women, that have horrible digestion, and we trace it back to birth control pills. So we have a whole page on my website, drsharif.com, that basically discourages women from using birth control pills. So you want to, for acne, you want to find the true address the underlying cause of it. And these drugs, of course, they don't ever address any underlying causes. So clearly homeopathy is offering hope. I treat acne constitutionally most of the time, but sometimes acutely, and sometimes I combine both. And you can go back to those earlier slides to figure out when do you do acute for acne, when do you do constitutional. We covered that, right? So, and again, acne in the repertory is not in the skin section, it's under face. And all the rubrics are listed there. This is just a little, I guess, what do they call it? Clinical pearl. So if you're a woman and have hormonal acne, think of the remedy sepia. It's an amazing remedy. I've had great success with that. Hormonal acne for women. And there are 2 other hormonal remedies, Nasbir and sanguinaria. You can read that last paragraph. So these are just various resources for you for acne. Lots of different remedies with their keynotes listed. You can go over that on your own time. Second remedy is acne rosacea. I find that more difficult than acne vulgaris. Rosacea is just more challenging, and you can get really severely infected. Patients can end up on antibiotics. So look out for acne rosacea. You really want to get the right keynotes, find the right remedy, and get started immediately, because if you don't and it's just progressing fast, the patient could become an urgent case. Okay, boils. Top remedy, my favorite, is Calcarea sulfurica, right there in big letters right there. I find that of all those remedies, Calc Sulf is it's a good one. I've had good success with that. I also have had good success with constitutional remedies for boils, but in particular, I like Calc Sulf. Dr. Robin Murphy recommends all these different remedies for boils. They're all listed here. I love this finding that he shares with us, that a lot of trauma remedies listed under bruising, they produce crops of boils, which means they're also helpful for boils. So boils and bruising, a lot of the remedies are in common. That's something Dr. Murphy pointed out, and I had to research it, and sure enough, there are a lot of remedies in common for them, for boils and bruising. Carbuncles, which is cluster of boils, same remedies. Calc Sulf again shows up. You can give it as a cell salt also. It doesn't have to be a potentized remedy. It could be a cell salt, which is, I guess you could say that's homeopathic too, but it's, weak. So bruising or ecchymosis, those are the rubrics. A lot of the remedies for bruising are also helpful for varicosities and hemorrhoids, because they all have one thing in common, which is venous stasis. And if someone has a bruise, there's an 80% chance that arnica could help. So you could start with arnica, and if it doesn't help, to treat the remaining symptoms, then you can find an acute remedy that addresses the remaining symptoms. So those are some awesome remedies for bruising. So remember, arnica is not the only remedy for bruising. You can also use hamomillus. You can use ledum, sulfuric acid. Bellis prennis is a remedies that are just phenomenal. Like if you have extensive bruising, arnica may not cut it. If you have bruising on the shin, on the periosteum, what's a good remedy for that? You can cheat right there. Symphytum or ruta. So arnica, if you have a large bruise on the shin, arnica may not help, because arnica is good for bruising in the softer tissues. But if it's right on the periosteum, you want to think of symphytum or ruta. So next condition is burns. Just going to leave that for you to go research on your own. Cellulitis. One thing I want to point out about cellulitis, because it's a life-threatening potentially condition, you want changes, you want to expect changes in 12 to 24 hours. You can't afford to wait a week to see if there's any improvements. Maybe in some cases you can. As a rule, you want to send the patient home with 2-3 remedies and educate them on how to use the remedies, and tell them to expect changes. If it's not any better within 12 hours, to notify you or go to urgent care. So according to the desktop companion, sulfur is one of our best remedies for cellulitis, and I agree. Notice in the synthesis, you don't find cellulitis under skin. It's actually under general inflammation, cellulitis. So that took me a long time to figure out. Where do you find cellulitis in the repertory? It's under general. So this is why this ended up being 140 slides, because there's so much information you guys need to know. If you want to take on skin, you need to figure out where to go in the repertory to find these rubrics, and then how do you dose, how do you decide, how do you take a case. So there's a lot involved, but pretty much most of everything you need to know is in the slides. For base, just to start doing it, not to master, but to start doing homeopathic dermatology, most of what you know is here. I would say the most important thing about cellulitis is what I covered. I've had a couple of cellulitis cases, and we did really well. And I just recommended 30C 2-3 times a day, and within the first 24 hours, the patient was better, so we continued for 3-4 days, and then we reduced the frequency. We are going to run out of time, like in 2 minutes, so I'm just gonna, you have this is available to you, so I'm not going to cover the rest really. I'm just going to read this chapter, the slide title. So we have crusty eruptions. These are some pictures for you for dry skin. I cover dry and cracked skin, which is an extremely common problem. Those are the rubrics for the condition. These are some remedies that are for extremely dry and chapped and cracked skin. Alumina, petroleum, and nadmi are my favorite, and you can read how they compare and contrast. Next condition would be eczema. Well, I'd say eczema and acne are the top 2 conditions we get, right, in a primary care practice. And probiotics, again, are a must as far as I'm concerned for treating eczema. Eliminating gluten, giving up gluten seems to be helpful, but then again, that seems to be palliative. Homeopathy tends to be more curative. Those are the rubrics again, some of the top rubrics for eczema. Different remedies. And just something to point out, Ross Tox can be a good eczema remedy, but notice, this is interesting. See, the keynotes of every remedy can be found no matter what part of the body you're talking about. Rust tox is a good joint remedy. It's a good rheumatological remedy, right? The keynotes would be better with heat, better with motion. So when they first wake up in the morning, rust tox patients, their joints are rusty, they take a warm shower, they get moving, and their joints feel better, right? Well, if they have a skin condition, it's going to be the same. If they have any kind of skin condition, let's say eczema or whatever it may be, itching, they go take a shower, the hot shower helps the itch. And as the day goes on, the itching improves. So if you see those keynotes of better with heat, better with motion, you're thinking rust tox no matter what the condition is, whether it's rheumatological or dermatological. Does that make sense? So those keynotes show up in every system. The headache of a rust tox person may be better with a hot shower and movement, whereas the headache of a bryonia patient might be better if they don't move, right? So that shows up. It's a pattern. Okay, we covered that already. Erysipelas, gangrene. Did you know we could treat gangrene using homeopathic remedies effectively? We actually have extremely effective remedies for gangrene, which obviously is a serious skin condition. Those are the different types of gangrene, and different remedies for them are all listed here, right there. We've got arsenicum and secali. My top 2 most favorite remedies for gangrene are arsenicum and secali. And I think Asiaga gives them routinely for gangrene. So I hear. Arsenicum and secali. But a master like Asiaga, I believe he does 3x. You know, like he keeps the patient on 3x for like months. Secali 3x. I think he routinely does that for his gangrene patients. You learn from these masters because I don't even have a 3x in my office. But apparently he uses 3x's and 6C's all the time. So the less you know, the more you're going to use 1M's and 10M's. It seems the more experienced homeopaths, they just lower the potencies. As they get more humble, they get the lower potencies. It's amazing. Okay, so the keynotes of these remedies are listed. Notice I've underlined a lot of the words that, to me, are key. So if you just look at the words that are underlined, that would be a good take-home message. Like agaricus, I wrote down that it's good for numbness and tingling, and it's a great remedy for Raynaud's. So these are the top keynotes that to me, that it was worth mentioning. Okay, so let's move on. We've got gangrene. Herpes. Take-home message about herpes. You can actually, believe it or not, you can, I don't want to use the word cure because it's politically charged, but I'm gonna. you can cure herpes if you know how to do homeopathy right. You have to address the miasm and the constitution, not just acute. So it gets really, really in depth, but you can actually do it. Have I done it? I haven't, because I just haven't had the honor of going that deep with patients. But it's my understanding that if you follow the guidelines in the slides that you have here, you could actually cure herpes. You have to address the miasm, the core constitution of miasm. Okay, so herpes simplex, you got herpes, genital herpes. We have herpes zoster, shingles. Definitely tougher to treat than herpes simplex, but I have had good success treating shingles. And no, I'm not pro-vaccine, shingles vaccine. As long as we have homeopathy, why do the shingles vaccine? Herpes genitals, okay, hives. We have wonderful remedies for hives. They're all listed again. To me, hives patients are just, their digestion and immune system isn't right. So I do food allergy testing for them. I recommend high doses of probiotics to every hives patient. And I find that, let's say, 100 billion probiotic bacteria a day by itself could turn hives around. I've had really good success with high dose supplementation with probiotics and hives. And of course, homeopathy can help the symptoms like that. The correct remedy can help within 24 hours or hours. Ichthyosis, which is fish skin disease, you have the remedies for that listed. We have remedies for ingrown toenails in homeopathy, believe it or not. Manganum australis, according to many sources, is the top remedy for ingrown toenails. Okay. Molluscum. Molluscum contagiosum is a viral condition, and I've seen probably 5 kids with molluscum the last 2 years. Every single one of them felt better within a week. So the correct remedy can just get rid of molluscum. You have to find the remedy, though. And I heard from Dr. Murphy that according to Indian homeopaths, 80% of the cases respond well to Nadmir. I don't want to misquote, but I'm pretty confident that's what I heard. So Nadmir is a good remedy for molluscum, supposedly. And the funny thing is that Nadmir is not listed in the repertory as a remedy for molluscum. So itching is probably, I would say, of all the conditions that I see, skin conditions, itching is the one that seems to be the most frustrating to patients. Chronic itching, it can drive people insane. There are a lot of different causes for itching. This slide here summarizes the 5 top causes for itching that I've run into. So various skin diseases can cause itching, of course, food allergies, food sensitivities, liver and kidney toxicity. I'm a big fan of detox. So again, we talked about John, how we detoxified his kidneys and the itching got better. Chronic constipation is a big problem that could be behind itching. And dry skin can cause itching. So you want to think about all that. When somebody comes in with itching, you want to ask them, is your skin dry? How are you constipated? Do you have any kind of a liver and kidney dysfunction based on what you know of your past, in your past medical history? Okay, lots of different remedies listed for itching. Psoriasis, this is again the most difficult skin condition I've ever treated. I think I've heard from just about the best doctors that I've ever come to have the honor of knowing. I won't mention any names, but every single one of them says psoriasis is humbling. So psoriasis is difficult. You got to cut yourself some slack. If you can't help 50% of your psoriasis patients, don't be disappointed. I would say my success rate treating psoriasis is at the very top 50%. It's very humble to say. Other conditions, 80, 90, 100%, but psoriasis, I can't say I've treated even 40%. So it's very difficult. So maybe with the resources that I've ordered from India, now my success rate can go up. But as of this point in time, I'd say it's 40, 50% maximum. So those are the remedies that I could come up with for you guys. Arsenicum iodatum is supposed to be the first best remedy for psoriasis, but frankly, I've seen it work maybe in a couple of cases. But it's like supposed to be the best. The keynotes are listed, as you can see. Okay, rash, ringworm. What's the top remedy for ringworm? Top remedy? Depends who you talk to, but I would say Dr. Robin Murphy's favorite remedy is basilinum. And if you talk to Dr. Roger Morrison, he would say sepia. And if you don't know which one to give for tinea, send them home with both. Basilinum 30C, sepia 30C. Have them start with basilinum 30C. I've seen in the last 6 months, I've treated probably 4 cases of tinea with basilinum 30C daily, and every single one of them got better within a few days. So basilinum, it comes from the, I would say, Bacillus of tuberculinum. And so tuberculinum itself is supposed to be a good remedy, but sepia is cited in many sources. Right here, sepia. It's good for tinea as well as pityriasis versicolor, which is closely related. So candidiasis is caused by candida, which is a fungus, but that's different from ringworm, which is caused by a dermatophyte. So the causative agent is different, but it's still a fungal infection. So what's candidiasis? What are the common diseases that are involved in, or candidiasis can cause? I'd say thrush, diaper rash, and yeast infection. And whenever you're talking yeast infection or any kind of infection in the pelvic region, what are the top remedies for pelvic infections? Thuja and metarrhinum. And metarrhinum, I would say, is acute for thuja. So if you have an acute pelvic infection, metarrhinum is a good choice. If it's chronic, thuja. Okay, scars. There are remedies, homeopathic remedies for treating scars. And you can find scars in the repertory under the section called cicatrices. So there are all kinds of different types of scars. There are bleeding scars, scars that break open, hard, keloid, painful, red, white. So you go to the appropriate section and find the remedies that are listed. But I would say, again, I love Dr. Murphy's repertory. He's listed those remedies under scars: calendula, fuluric acid, graphites, nitric acid, silica, and thiacin. So those are the top remedies in I'd say several of the repertories I've referred to. Okay, right there you have the top 3 remedies for scars right there: calendula, thiacin, which is short for thiacinaminum, and then staphysagria. And the keynotes are listed under each one. Okay, ulcers. There are many different types of ulcers: bleeding ulcers, varicose ulcers, gangrenous ulcers. Depending upon the kind of ulcer you have different remedies. So I didn't list all the remedies for ulcers, but you can, you have to just realize there are different types, and each one has different remedies listed in the repertory, and you have the citations so you can refer to them. Noteworthy point: pulsatilla is listed under just about any kind of varicosities. Pulsatilla. It is a major constitutional remedy, but it happens to be great for varicose veins, varicose ulcers. And I had a patient with varicose ulcers, happened to be constitutional pulsatilla just a month or 2 ago. Pulsatilla 12C is completely turning it around. It's amazing. You can actually treat varicose ulcers. They don't have to always have surgery. Okay, vaccination, you can read that. Warts. Okay, warts has become like my #1 specialty. So I have probably 6 warts videos on my website before and after. The way to treat warts would be with a constitutional remedy. Acute prescribing for warts doesn't make sense to me. Constitutional is the way to go. It's one of those situations where you do need to do constitutional. And I have never had a warts patient that I treated effectively and the warts came back. Once you treat it, it never seems to come back. Even 5 years later, the warts don't come back. Not even one wart. So it's maybe difficult to treat it, but if you find the right constitution, you can actually treat them. And here are some ideas for you right there, some specific remedies. Depending upon types. There we go. These are the different types of warts. You have bleeding warts, flat, smooth warts, cauliflower warts, hard warts, horny warts, pedunculated warts, sensitive warts, stinging warts. So as you can see, thuja is not the only remedy for warts. So when I get a patient that goes to a health food store, they're like, oh, I tried thuja, and I'm looking at the wart, and the wart is a hard wart. If it's a hard wart, I'm like, no wonder thuja didn't help, because you needed antimonium crudum, because it's a hard wart. So you have to figure out what kind of wart, and then the remedies are just listed. You have 2 or 3 remedies listed, so it can't be that difficult to get rid of warts if you find the exact type of wart. So you have to look at different pictures and be able to identify, diagnose the wart correctly, and then the remedies are listed. Venereal warts, I'd say that my top remedy for venereal warts is thuja, but then again, thuja is one of the top remedies for any kind of gynecological or pelvic infection, so that includes a viral infection that we call warts. It's an important remedy for any kind of venereal disease, I find. Staphysagria is also another great remedy for venereal warts. Okay, wounds, there's a huge section on wounds in the repertory. You gotta, again, figure out what kind of wounds, what caused it. And when it comes to wounds, etiology definitely is critical. You have to figure out what caused it. Was it caused by a poisonous animal, or was it a stab wound? Was it a cut? Is it a bleeding wound? So depending upon the type of wound, you have different remedies listed. And then I think this is where it's basically done. Detoxification, again, detoxification can be used as a backup to homeopathy, or it might be required for homeopathy to work. So either I do it concurrently, or sometimes I do detox first and then do constitutional. So just remember that sometimes if you find homeopathy not effective, the patient might be very, very toxic. The organs, the specific organs might be so clogged up with toxins that the constitutional remedy is just too weak to address. So you have to go in there, unclog, or clean up the organs first before the constitutional can take effect. Now, that's probably the best take-home message. I used to teach detox for years at Bastyr. I would say, in a nutshell, the way I think of detox versus constitutional, if these organs are clogged up, the constitutional is just not powerful enough to get into the liver or the kidneys or the intestines and flush out all those toxins. You might need local remedies, like a Unda number 243 for the liver, or some bitter herbs for the liver, or some herbs for the kidneys, and then the constitutional can take effect. So that's the take-home message. I would say of all the things under detoxification, constipation is the most problematic problem. If a person is constipated, you got to fix that before you can treat just about anything else they have, whether it's a skin condition or not. So the first question, probably within the first 10 minutes of my case taking, I always ask people, how often do you have a bowel movement? If it's less than one a day, I'm thinking the person is probably toxic. So you got to think of things you can do to help detoxify them, get the constipation under control before homeopathic remedies can take effect. And here's the last slide. I have a website called Visual Homeopathy. I've taught visual homeopathy throughout North America for years. It's basically the whole system is based on looking at the person, talking to them for a few minutes, and if they are one of the top 20 remedies, constitutional remedies, you should be able to figure it out like that. And so we have video modules on that website. You can actually go sign up and watch videos to learn these basic constitutional remedies. I don't think it's going to help you with, I would say, skin diseases per se, but it'll help you with constitutional prescribing. And that's all my contact information. You're welcome to call me, email me if you have any questions. And I think that's about it. So if you have any questions, I'm going to stay outside the room to answer questions. And thanks for your attendance. Thank you.